Hello, friends, and welcome to the third episode of Think Free, a screencast that we've created to learn some shit and to have some fun during this coronavirus pandemic lockdown. And as a society where freedom is flaunted as an inalienable right, it's going to be hard to keep us held down for much longer. So we've brought in one of the foremost experts in staying healthy while traveling, the travel MD himself, Dr. Ronald Primus. My name is David Choi, and I want to thank you all for tuning in and helping to make our brand of edutainment a staple in your daily diet of useful information. And thank you all to our donors for helping to make our work and wellness a reality. If you know anyone who could benefit from the wealth of knowledge contained herein, please do take a moment to share this with your friends and family on social media and take a moment to follow us on Facebook, Instagram, and just subscribe to our weekly newsletter. So I'm not going to beat around the bush here, and by that I mean the mop on this head here. But there will come a time when I will have to put my foot down and say, I need a goddamn haircut. And no amount of YouTube videos are going to teach me how to cut my own hair. But how do we do that? So how do we get to the barber, and what's travel gonna look like in 2020, in the next 2 years, 5 years, 10 years? And for this, we turn to our travel doctor to the stars, Dr. Ronald Primus. He doesn't like me mentioning this, but he's a celebrity MD. He was just doing a podcast with Ludacris on travel medicine, and COVID. So we can talk to him about that. But before we bring in the big guns, we are going to have a little bit of trivia for you all. Compliments of liver health. Oh, wait, here we go. Ronald is calling me. Jesus. Hey, Ron.
Hey, it's saying that you need to let me back in.
Oh, gotcha. All right. We are going to readmit Dr. Primus.
Yeah, I think that's it.
Okay, you're in. All right, cool.
All right, thanks.
Thanks. So, back to the trivia. So the first person to answer this correctly is going to win Compliments of Lever Health, where you can sign up for some stellar one-on-one virtual health and nutrition coaching. The winner of tonight's trivia is going to take home a Wi-Fi enabled smart scale by Withings Body. So everyone, the big brother, can know how much you weigh every single day of your life. All right, so the trivia question is, so if you're ready, please send your answer directly to Julia Olafson, who is our production assistant. All right, on your marks, get set. Here's the trivia question. McDonald's has recently stated that they would discontinue this at their restaurants in order to meet the new coronavirus hygiene standards. Is it A, the Big Mac, B, McGriddle's breakfast sandwich, C, self-service soda machines, or D, Southwest grilled chicken sandwich? All right, so remember, send your answer directly to Julia. And now we're gonna move on over to our featured speaker of the day. His name is Dr. Ronald Primus, and he is a board certified and doubly recertified internist, a preventive medicine specialist, and is a fellow in the American College of Physicians and the American College of Preventive Medicine. And that just scratches the surface because he is a travel medicine expert and is doubly credentialized in travel medicine by the leading national and international organizations in travel health. He is certified in clinical tropical medicine and traveler's health from the American Society of Tropical Medicine and Hygiene, and certified in travel medicine from the International Society of Travel Medicine. Lots of travel. You must be the travel MD. Dr. Primus is a contributing consultant to National Geographic, Traveler, Self, Health, Manhattan Living, and Forbes magazines. And as a travel medicine expert, he has been featured in the New York Times, the Wall Street Journal. I can't believe this. Ronald is calling me right now.
It keeps freezing, so I'm gonna try and do it from my cell phone.
Okay, so
All right.
Dr. Primus is going to call in from his cell phone. So,
I don't know
Julia,
what's happening with this thing because it's like it's crazy. It's my computer. It's not you guys.
yeah,
It just keeps restarting for some reason.
sure.
All right. Sorry. I'll call you. I'll link on Zoom.
Okay. We'll try to wait for you then. Thanks. All right, so here's Julia Zhang. All right, so I'm going to continue with his bio here while he is logging on. Dr. Primus is a contributing consultant for National Geographic. He's been featured in the New York Times, the Wall Street Journal, the International Herald Tribune, New York Resident, CNN, Good Morning America, the Discovery Channel, ABC News, CBS, CBS News, Extra TV, NY1, USA Today, Newsday, and Fox, pretty much every single network you can possibly think of. And he's been on Making the Band 1, 2, 4, Making the Cut, Band in the Bubble, Kimura, Life in the Fab Lane, the Food Network Channel, Discovery Health, Travel Emergencies. Yeah, he's been around the block. So, while we're waiting for Primus to come on board here, I did want to mention that this style of meeting that we're going to have for Think Free is kind of an open conversation. It's not the webinar format. I just wanted to have a kind of a group of people come together and just ask some questions. And here is Primus. And so we're all during the Q&A portion. I would encourage anyone and everyone with a question to just raise your hand and chime in. You can unmute yourself, turn on your video if you like, and jump in on the conversation. All right. So, Dr. Primus, are you there? Okay, you are. I'm going to unmute you. Here you go. Hey,
All right.
Ron.
Can
All
you see
right.
me?
Yes,
All right.
we see you. And
Cool.
it's great.
Anyway, thanks for the intro. That's great. I appreciate it. Thanks for
Hey, no
having me
problem.
on.
Yeah, no, super awesome to have you.
And it's
And
been a long time coming. I know we've been planning this for a while.
too long, too long.
Yes. But
And
thank you again.
of course, and we're gonna have you back, I'm sure. But so let's start off with some questions here. So I read your bio, and obviously you're the world's most travel MD. Is that true? Or like, how long have you been
No,
doing this?
oh, 27 years. Long time.
Okay,
Long
got it.
time. But,
And
it's fun. It's interesting. And it keeps me on the forefront of everything, because, you have to become kind of expert in emerging diseases and all that
mhm.
sort of thing. And so I love my job.
You love your job, and you've been like knee deep in the coronavirus thing since the very beginning. You've been on the front lines.
Yes.
Can you tell us a little bit, give us some insight as to what's going on out there? What are the trends? Like, what do you forecast for New York?
So I think the whole thing continues to evolve. And so when it first started, like so in February, no, end of January, I was in Asia, and only brought masks with me for the plane just in case, and was staying in a hotel in Singapore and in Thailand where people had the coronavirus in the hotel we were staying at in Singapore, but we didn't think anything of it. We didn't see how deadly it was, and I really didn't think it was going to become a pandemic, to be honest, until I got back, and people were calling me. They were really, really sick, and it just spread like wildfire. So this thing is completely gotten out of control.
And
Um,
you were saying that you were seeing incidences of this in December,
yeah.
January?
So retrospectively, again, before I went to Asia in December and January, there were people that were coming to my office that had flu-like illnesses, which I was sure that it was the flu. And half of the people, some people like to exaggerate. Oh my God, it can't be the flu. This is worse than the regular flu.
Mm,
Influenza A is very, very problematic, right? Influenza A, people feel really sick, burning in the chest and fever, and nothing makes them feel better. And I was testing them, not everybody, but maybe 15, 20% of people I was testing, the test was coming back negative. And I was like, oh, that's weird. Must be some other virus, or there's a defect in the test. So I had my staff reach out to the manufacturer to see if there was a defect with that particular lot number. Because that particular box, I was getting a lot of like what I believe to be false negatives. I opened another box because I stock up on flu tests during the flu season because a lot of people like to know what they have. And second, the problem was happening with the second box that I had as well. Retrospectively, those people, some of the people that I recalled came back and retested and came back positive for COVID antibodies. So yeah,
Mm.
I've been seeing it since December. Just to show you how just simple things to protect yourself are really important. Every time I see any patient with either, any upper respiratory infection, especially influenza, I always wear my N95 mask and I glove and I wash my hands before and after. And my staff will go ahead and sterilize the room and use Lysol on the doorknobs, or use they'll sterilize the bathroom. And I tested myself and my entire staff for corona, both nasal, blood, and rapid finger stick, all three, and we're all negative. So whatever minor things we were doing, including myself just wearing a mask and gloves and washing my hands, was simple enough to prevent us from getting it. So it's just really, really interesting how it had probably been here longer than we think, especially because New York City is a major hub. And there was a lot of people we were seeing coming in. Majority of the flu that I was seeing were people that were coming in from Europe. So probably people from Asia were going to Europe. People were getting sick, probably in Italy even way before that. And then coming to New York to vacation, especially, Christmas time, right? So it was packed. And a lot of these folks had coronavirus and didn't realize it. So it's here a lot longer than we think.
Very interesting.
Probably the reason why we see such an exponential kind of rate here in New York City, because it had been here longer and unrecognized for a lot longer.
And that's fascinating that you had some people test negative in the beginning and then they tested positive for the antibodies. Is that
No. Tested negative for influenza.
Influenza, gotcha. Okay.
Because we thought it was flu, but we keep records on everybody, and the people that so I have a system in my office where if someone tests positive for influenza A, I'll write influenza A. If they test positive for B, I'll write influenza B. If it's inconclusive or negative, I will just write influenza because they had an influenza-like illness and tested negative on those tests. Now, truth be told, there's always a 3 to 7% margin of error on those tests, but we kept records on the people that the diagnosis was just influenza without designated A or B. And some of those folks that we recalled and tested, were positive for corona IgG, sorry.
And so if we were to give our listeners or anyone here some advice as to how to protect themselves when things start to open up. So you were saying that the hazmat suit is kind of overkill. You don't actually need to go that far.
I think it's overkill. I mean, I do it personally because when I do house calls and I'm seeing all these people on the front lines and I'm doing nasal swabs and they're coughing, I mean, let's face it, it is a deadly virus in some people and I want to protect myself. So yes, I hazmat. But for the general public who doesn't have the kind of exposure that I have, just simply wearing a mask, as good a mask as you can. I mean, if you can get your hands on a good N95 mask, that's probably best. And then just frequent hand washing if you don't have access to gloves. So I think just keeping it simple. Now, I mean, I know there's some doctor apparently that claims that it got through his eyes, but I don't buy that. He probably got it somewhere else. Yes, you can get it through your eyes, but that's if someone directly puts droplets into your eyes from, aerosolized coughing or sneezing or something.
Are you going to wear goggles if you go on a flight? Because someone was talking about that, right?
What I'll do is I'm probably going to bring a pair with me, and just in case, just like I do with my N95. Of course, now I'm going to use N95 every time I travel. But I don't know if you ever traveled with one, but I went from New York to LA one time, wore it the whole time because the guy sitting next to me was sick. And it's so uncomfortable wearing a mask for that long, especially on the bridge of your nose, and your face gets imprinted. It's a long time to wear a mask, but so whenever I travel, always for years, I always kept an N95 in my bag, and same thing for my family. Whenever we travel, if someone sitting next to us is sick, we'll just put it on and wear it. If nobody's sick, we just leave it off. The air on an airline is actually cleaner than a breathe outside sometimes, right? Because it goes through a HEPA filter,
Okay.
And it's sterile. It's bacteriostatic. They have things in it that keep the air pure. I know there's a lot of misinformation out there, but because I'm a travel medicine specialist, I see all the studies that come in, and
Okay.
these are not studies that are produced by airlines and that sort of stuff. What gets people sick on airplanes is sitting directly next to what's called an index case, right? So if you're sitting either next to a person who's sick, in front of or behind a person who's sick, um, your chances of getting sick are pretty high. The only cases that they had of other people on a plane where it could have been aerosolized was there was a couple of years ago. I don't know if you remember, also a big media sensation. There were people that got sick on a plane with multi-drug resistant TB, and they were like a few rows ahead. And even though that air was recirculated, um, whoever coughed with tuberculosis, the aerosolized droplets just kind of stayed in the air a little bit longer and infected some people that were pretty remote from where they were. Um, but air travel, the air on airplanes is actually pretty safe. It's filtered pretty well. The
Okay.
people that you have to worry about are the people that are in direct proximity to you.
Gotcha. But we are looking at an industry that's in decline
Yes.
and is struggling, and like they have no choice but to pack everyone in like sardines, right? And that's really going to up the risk.
Right. So that's why I said that, from now on, whenever I travel, yes, I'm going to wear a mask the entire time, wear gloves. The other thing is, the other trade secret is, if you're going to book a flight, when you book your seat, do not book near a bathroom, right? Book as remote from a bathroom as you can, because they have done studies and they found that if you, like, the closer you are to a bathroom seat, the higher the bacterial count on that seat, right?
Hmm.
So now,
Hmm.
because COVID can also be passed in the stool, it's assumed that someone, because there are people with COVID that only have diarrhea as the only symptom, right? And they're going to be in that bathroom, and there may be COVID in the bathroom on the armrest next, because the
Oh,
airline, the
yeah.
airplane, as it's moving, is kind of shaking around, and if you have to go to the bathroom and the airline's bumping up and down and moving side to side, you see people touch the headrest as they move, down the aisle to go to the bathroom, right? The more people that are close to the bathroom, the more their hands are touching that seat, and the higher the infective rate. So even if you're in first class, you want to stay remote from the bathroom.
Wow. That's quite discomforting to hear.
Yeah.
But so, I mean, gosh, I don't know if I'm ever going to want to fly or even use bathroom on a plane now,
Yeah.
now that I
So
have a picture in my head.
again, it's important when you travel to bring masks, gloves,
Yeah.
wipe, and wipes.
Okay.
Uh,
Yeah.
Super important. Um, so
Yes.
it's not new, but like, it's called Sanadex or something. There was these wipes that have PAA and hydrogen peroxide together. And that particular mixture, when we use it in hospital settings to clean colonoscopes and clean bronchoscopes and all that stuff, will kill spores, and it kills anything. And they're up for FDA approval probably this week to use in other industries. And the great thing about this is it's organic, it's natural, and you can even use it as a fruit and vegetable wash. So even though it has that kind of kill power, you can still use it on a fruit and vegetable wash, and still eat the fruit and vegetable, whatever with
Hmm.
it. Yeah.
Hmm. Hmm. Cool.
So I'm going to try and get some of those wipes and take those with me when I travel. So
Mm,
pretty simple stuff.
great. Non-toxic. Um, okay, so we were having a conversation, I think it was yesterday, and you were saying New York City's done. What does that mean? Like,
All right.
so tell me, paint the picture for us. Like, what are we gonna look at this
So
year and next year?
I think I forgot who did the study, but I read a study either. I think it was in the Associated Press, but someone did a canvas of, like, what are the top destinations you would like to go to moving forward. And New York, which used to always be like number 3 or 4, was, I think, like number 17. So people are scared to come here. And the other thing is that the Broadway shows are going to be done, probably till September, October, I heard. So the whole summer season is, um, you know, uh, pretty much over. Nobody's going to be traveling here. The hotels are like dead.
Mm.
I don't even know why they're planning to open so soon. It's, you know, it's because of fear. Even if the virus does go down, people are scared to come to New York because this is the belly of the beast, right?
Yeah.
This was the epicenter in the United States, and so it's just got that kind of, you know, same thing. Like, so for example, after 9/11, because I do travel medicine, it had been about a good year and a half, 2 years before people felt comfortable coming back again because they were scared of another terrorist attack. So, you know, you
Yeah.
got to get people to feel comfortable to want to come back again.
So you had an interesting statistic. You said that New York was actually number two at some point, and now it's number 17 in the most sought after travel destinations.
Oh, I mean, I believe it or not, Asia was like second, and you would think that that wouldn't be right because of all the illness that they had there. But I think Asia, Europe, I forgot where in Europe was number one. Asia was number two. Florida was up there. Um, Hawaii was up there. So there were these remote places. You know, don't quote me on this because, but there were, you know, it made sense to me. I was like, oh, okay, those are pretty much COVID-free places, and that's why people are going there. The only thing that didn't make sense was the whole Asia thing because, you know, that's also pretty significant with the amount of COVID that they had. But I think it was number two.
Mm.
So that was interesting.
Yeah, very interesting. So yeah, it's going to be a pretty bleak situation for the tourism industry here in New York City, for restaurants, for hotels, any business that depends on tourism. So
Right.
they're pretty much done.
Yeah.
And I don't know, do you know off the top of your head what the percentage of the GDP for New York City is tourism?
No, but I know it's going to
It's going to
it's
plummet.
going to take a major hit, and
Yeah.
you know, so I don't think it's going to bounce back for a while. Now, when it does bounce back, it's going to bounce back with a vengeance. I mean, because people are going to go stir crazy, they're going to want to come here, and then, you know, the hotel is going to be deep discounted because they're going to want to entice people to come back. The Broadway shows are probably going to be at half price. Restaurants are going to probably do 2 for 1. I mean, they're going to entice people to come back. So eventually, it will do it. So the only drawback is going to be uh, the thing that it kind of hinges on is when are they going to have a vaccine.
Hmm.
So number one, vaccines probably at best a year out, and then you have to go ahead and you have to kind of immunize not just the entire population of New York and the rest of the United States, but you have to immunize the rest of the world, right? And have it get out there, almost like, you know, measles and polio and all that sort of stuff back in the days when that used to be pretty prevalent, because, you know, people are not going to feel comfortable traveling till the entire planet is pretty, you know, pretty much immune.
Yeah.
Or if they come up with, I know they're working on clinical trials now of using hydroxychloroquine as a preventive agent, you know, like maybe like a more benign, safer type of hydroxychloroquine-like agent
Mm.
that people can take every day to kind of prevent them from, you know, getting
Uh,
the virus. So
right.
until either one of
Well,
those
it's not
two
going to
things
prevent
is
you from
developed,
getting it, right?
well,
There's a
no,
drug that,
no, no. The hydroxychloroquine prevention studies, you know, some of the preliminary trials show that it does prevent viral attachment to
oh, okay,
cells. Yeah. So yeah, no, it can, it is a preventive. But
great,
again, that study is not out yet. They're still looking at that.
right. We do have a question from Mark. I don't know, I can unmute you if you would like to ask the question yourself. Mark, I have unmuted you if you'd like to jump in here. Mark?
Hello?
All right, I'm going to ask Mark's question for him because he had posted it in the chat. He says, can you
Can you hear
post?
me?
Yeah, hey, Mark.
Hey.
Oh, great. Thank you. Little technical difficulties as we're all having around.
Happy to have you.
Thank you. A couple of questions is planning to fly to LA in mid-June. We're going to spend the summer there, if not longer. I moved out of New York City about 3 weeks before the shit really became well known. So I've been in New Jersey as my wife. And we're kind of, well, we wanted to go to LA anyway for business, but we're going to plan to be there in June to at least September. Is that foolhardy to travel at that point? Or do we just, if we do the precautions of mask and
If
things?
you do, if you do the precautions of mask and gloves and try to not touch anything, and, you know, bring wipes with you and take those precautions, you probably will be okay.
What about like a, I don't know, like a air, what do you call it? Like, what do you call those things? Like some kind of air thing that could neutralize the air around, like with some kind of like essential oils or
Like a spray type of
yeah,
thing?
a spray or like I don't know. There's such a thing as a battery operated
Mhm.
diffuser. That's what I was looking for.
Mm.
Like
I
essential.
mean, it can hurt. I mean, I know some people that put colloidal silver in their nostrils when they travel, but more importantly, it's to keep your air passages moist. So you can get something like Rhinaris gel or Air, AYR nasal gel,
Mm,
because the drier your nasal passages are, if there is a pathogen, it can enter through drier cells and not get trapped up in the mucus barrier that you have. So using a salt water based gel is a really good thing to have, and also really important is to not have any alcohol on the flight, right? Because if you
yeah.
drink alcohol, it'll make you dehydrated, and that can definitely dry out the respiratory tract and put you somewhat more at risk.
Well, we've been since this we went down. We've been on a protocol with different like mushroom resources and just a lot of healthy herbal products just to keep the immune system going. And so we'll continue doing that, especially when we travel.
Yeah, no, it's
Cool.
very important. Yeah,
Nice,
no,
Mark. What kind of mushrooms
I,
are you taking, Mark?
I'm taking there's a product by Host Defense called Breathe, which is a combination of reishi,
Hmm.
um, cordyceps, and chaga. Been taking elderberry, been taking extra zinc, been taking I'm just thinking off the top of my head,
Mm.
astragalus, no, not too much astragalus, ashwagandha, turmeric,
Mhm.
cat's claw, extra vitamin C, along those lines. I just collated a lot of information, and David, I could email it to you if you like.
Yeah, great. I would love to see
Just
that. So
like
you
every
sound like you're taking all
also
that preventatively?
Well, what happened was my wife actually was when the shit went down. She stayed in Manhattan. I just couldn't stay in the city anymore. I just like a lot of besides what that was going on, I've been dealing with a lot of personal like angst about life and stuff. And I think
Sure.
partially I kind of picked up on the energy that was about to go down on the
Hmm.
world like 3 weeks before.
Hmm.
So I'm pretty sensitive to that kind of stuff. So yeah, and she stayed in New York a little bit longer, and I moved to New Jersey, and we're just taking it just for precaution. Like what the hell? I mean, it's not like bad stuff. It's not, it's not like taking some kind of heavy medication. It's like, what's wrong with reishi mushrooms anyway?
Hmm.
And if it doesn't, if there's no danger, there's no danger.
Right.
A question I have, doctor, is about the vaccines,
Mm.
and
hmm
at this day and age, there's a lot of, and I have mixed feelings about the whole vaccine situation personally. So how you think people are going to respond on at least on a national level when there's so much anti-vaccine,
Oh,
whatever
I mean,
fever?
I think that there's, a lot of hesitancy, anytime the new vaccine is put out there, right? Because, even though they do a year and a half clinical trials in, lab rats and humans, I mean, even myself, I mean, I'd be hesitant to take it and be one of the first people to do it. I wait till it's out and then, do some aftermarket studies and see what happens in those people. Um, I think that, if you, in our community, like, we're all pretty healthy and, we're biohackers and, I live a whole paleo lifestyle. And I think the healthier that the host is, the less likely that any pathogen can kind of take hold. So I think to answer your question, I think vaccine is important for a lot of people because not a lot of people are like our community, right? A lot of people that are in the United States are out of shape, overweight, obese. Um, they're more at risk of, succumbing to coronavirus than we are. So I think that if you're in an at-risk population, then yeah, you definitely need the vaccine because, you have to look at the risk to benefit ratio. And, the people that are at risk of dying from corona are going to have, probably, no side effects from the vaccine. And I think ultimately, me personally, I think that as time goes by and the vaccine is developed and it's been in aftermarket studies that show pretty, significant safety profile, then I'll take it at some point, but not right away.
Tell us a little bit about your biohacking lifestyle. I know that you definitely stay fit. You're one of the fitter MDs that I've ever met.
Thanks.
So, um, and also, like, how does exercise play into, strengthening your constitution and keeping you resilient from COVID?
So, I mean, I'm sure it has something to do with it, but
I
I
mean, there was
mean,
that study from out of the University of Virginia with the extracellular superoxide dismutase or something, like that is higher in people who exercise more,
yeah,
and in the people with asymptomatic COVID, they have a higher prevalence of
that could be.
this. Yeah.
Yeah, yeah. So, I mean, I try and keep it simple. So first I do time restricted eating. Usually, the way it works, I try for 18. I try hours a day. It usually works out to like 17 or 18 hours of time restricted eating. I do that prolonged every 3 months. My wife and I, do that every 5 days. Sometimes we go into 6 days. And I can tell you what's amazing is how my HRV, when I do prolonged, goes like through the roof.
Yeah.
And my resting heart rate drops into like the low 40s. And so, I mean, just that type of like prolonged fasting just does just so much.
Yeah.
The other thing is um, I exercise every day, so I'll
What
do
kind? What do you
Monday,
do?
Wednesday. So I do strength training 3 days a week. I'll do like back and biceps on Monday, chest and triceps Wednesday, and then legs and shoulders on Friday. And because I'm 60, I'll do, it's better to lift heavy and less reps. So, I do heavy, less reps. And then on,
And wait. So just to clarify for anyone listening, like, why is it better when you're older to do heavier and less reps?
because there's less sarcopenia that way. So, as you get older, no matter what, you'll develop sarcopenia, and this kind
Mhm.
of the heavier you lift, the less sarcopenia that you have. Although, like, there's some new studies coming out now showing that it's not so much the muscle mass. My Bluetooth's about to die. Tell me if you.
Ah,
Me okay?
yeah, I can hear you fine. Yep.
Okay. So the thing is that some newer studies coming out showing that in older adults with sarcopenia, doesn't matter how much mass that you have, it's the strength gains that are important. So, for example, I was talking to a researcher and lamenting that I lift really heavy and that I'm just not getting the mass that I did when I was younger. She said, well, it doesn't make a difference because it's more important for you to have the extra strength than for you to like be all bulky and whatever.
Hmm.
So yeah, so as you get older, you need to lift heavier. Um, I know there's some studies showing like more frequent repetitions and less weight, but if you look at if you do a meta-analysis, heavier weight,
Hmm.
less reps,
Hmm.
or as many reps as you can do with heavier weight is
Right.
best. Then on
Less chance
Tuesdays,
for injury too, right? I mean,
less chance of injury. I
yeah.
mean, you also have to have a spotter, right? Because you are lifting heavier, and you want to really push yourself. You don't want to kill yourself either. And
Hmm.
if you're doing like a skull crusher, right? With
Hmm.
a heavy weight, you don't
Hmm.
want to like have
Hmm.
it come back and hit you in the head.
Hmm.
So,
Oh,
but
but
so you have to be careful.
while we're on this topic, I was just talking to a friend of mine who is also a budding personal trainer. But so like deadlifting or any of these heavy lifts that you're talking about, you can actually use less weight if you're using a resistance band, or like sometimes you see big guys are using the heavy chains, and then
Yes.
like when they're the higher they go, the heavier the weight becomes because you're lifting more chains off the floor. Same thing with the resistance bands. You can put just nominal weight on there, but if you add a resistance band, you're increasing the resistance as you're coming to the top of your rep. And so that actually increases your explosivity and your strength. It
Right.
will confer greater strength gains over time if
Yes.
you're able to do that.
Time under tension. Also, the negatives are really important too, right? So if you're using the band, you're also having resistance on the way down as well, like
Hmm.
on the
Hmm.
release.
Right.
So that's important to do. And then what else do I do? So I'll do um, endurance training like on Tuesdays. I'll go. I mean, now I have to run. Normally I do all indoor stuff, but clearly gyms are closed, so it's a bit different.
Yeah.
So I'll do endurance training for about an hour, and then on Thursday, I'll do high intensity interval training, and then just do an hour of just sprints and then stop and sprint and stop. And then when Chelsea Piers was open, I was doing gymnastics on Saturdays or Sundays because I think that gymnastics is really functional. I mean, I'm not a big CrossFit guy, but to me, gymnastics puts together strength training and agility and flexibility and cardio. So it whatever you do during the week in strength training and cardio, it kind of puts together in this physiologic, like rope climbing, balance beam. I mean, all that stuff just is amazing. And then on Sunday, I'll stretch.
Cool.
So
awesome. So I do want to go back to some travel talk, and I know, like, you mentioned travel secret, and one of your travel secrets was, or travel tip was, to not sit next to the bathroom.
Right.
Do you have any like golden nuggets of advice like that?
So one thing that's super important and everybody overlooks is, if you're gonna, I mean, are you talking about short-term travel or travel to exotic places, or doesn't matter?
It doesn't matter.
So I always say it's really important to see a dentist, because believe it or not, the number one travel-related stuff that I see is dental issues, right? And if someone's going to Botswana, for example, and they have a cavity that they didn't address before they left, and they're in Botswana, and they're there for a Peace Corps mission or something like that, and they have to see a doctor. But not that the dentists in Botswana are not good, but the sterilization techniques are not the same. And there's been some studies showing that there may be, from dental work, some transmission of hepatitis C and HIV infection. Ooh. So it's always, the number one pearl is to always see a dentist before you travel, to these underdeveloped areas. The other thing is, if you're going to go to these underdeveloped areas, make sure that you see a true travel specialist, so that they can do a full history on you, see what vaccines that you need, make sure that your vaccine's up to date, age appropriate. So, a lot of people are lapsed in their measles vaccination. So measles vaccine is a good thing to have, because you don't want to get measles when you travel. If you're in a remote area and you're doing some animal work, for example, you want to make sure your rabies vaccine's up to date. So it's very destination dependent, right? Other thing is, make sure you bring condoms, because the second most common travel-related illness I see is venereal disease. I tell people, whether they're, doing oral sex or whatever, you can still transmit. I cannot tell you how many people come in with herpes and like, oh my God, all I got was oral sex, and how can that happen? She said she was clean or whatever, right? And I'm like, well, did you have a cold sore? Well, yeah, kind of. So just always make sure that you bring condoms with you. For oral sex, make sure they're flavored condoms, and for regular sex, just always use it, because I cannot tell you how many sexually transmitted diseases I see and treat in return travelers.
And in our very first conversation, I do remember, and I hope you don't mind me bringing this up, but you were saying that you're like, in terms of these kind of
the married
STDs,
women thing?
it's more women than men, right?
Yeah.
That's wild.
So, it's crazy. And usually there's alcohol involved, right? So people let their guard down. And, the interesting to me is how, like, you'll have the worried men who come in that'll be like, oh my God, I slept with somebody, I got drunk, and, I think I have something. I'm like, well, use condom. Well, yeah, I did. I'm like, you mean the whole time? Oh yeah, of course. I'm like, well, what are you worried about? Well, I mean, because I hope I didn't get anything. So, and then what would be interesting, if a married woman would come in and I'd say, okay, you have chlamydia or you have herpes, now you have to tell your husband or whatever. Oh, you know what? If I'm doing this, he's probably doing the same thing. I'll make it look like he gave it to me. So I find it's fascinating to me.
Wow. Okay.
Behavior is amazing.
Behavior. Yeah, and the stereotype is always, it's the guy, right? It's always the guy who's going out on a business trip and whatnot.
But they tend to be more scared, because they don't want to get their head handed to them when they go home, right? So they will tend to, unless they're not bright and they're really too drunk and they don't use the condom the right way. But seriously, it is the second most common travel-related illness that I see.
Second most common. What's the first one?
Dental, and then after that is like gastrointestinal, upper respiratory, that sort of thing.
Yeah, I definitely had that when I was in Thailand. I went to Bangkok. for two
Yeah.
weeks, and I guess I had some street food, and this
Yeah.
was at a time when I wasn't working out, wasn't like trying to take care of my body or keep myself strong. I was in my early 20s, and I was just sick, like with the flu, diarrhea, fever. I went to the hospital, antibiotics, didn't know how to treat it. Eventually, it went away, but it was just it ruined the entire trip.
Yeah, that's why when people come in for travel consults, I go over everything with them. Like
Yeah.
some people, like when after I do a travel consult for whatever reason, they're like, oh, you know what, I'm just not going to go. So, and I don't mean to scare people. My job is to educate people,
Yeah,
really.
yeah. Oh, I'm just not gonna
So
go.
yeah,
That's crazy. Wait, so also if you're in that situation, let's say you are in Mexico and then you get hit by a bug and you're it's day one or day two of diarrhea. Is
right.
what do you do? Like, is there a way to stop it dead in its tracks?
So so before um, before when my patients come in, I'll give them a prescription for rifaximin, which is Xifaxan, and that literally, will take care of any travel-related diarrhea. And then I give a backup prescription of Zithromax. Used to be Cipro, but Cipro's been so overprescribed throughout the world.
Are these
That
antibiotics?
these
Wait,
are
sorry.
antibiotics,
Okay.
right? So if you don't have access to an antibiotic, then believe it or not, Pepto-Bismol works the best. So
Pepto-Bismol.
Pepto-Bismol. And in fact, you could use it as preventive. It's messy because it makes your stool really thick and black and your tongue
Hmm.
black. But taking Pepto-Bismol, what time they travel,
Sorry, you're cutting out there.
and it's good for treatment as well. Can you hear me?
Oh yeah, it's a little better. You're back, I think. Yeah.
Okay.
Cool.
So yeah, so Pepto-Bismol, both as a preventive and a treatment, really works. So always make sure that you carry Pepto-Bismol. You don't even have to carry the bottle; just the chewable tablets are fine.
Mm,
So
okay.
that works. Also, good probiotic. Like I like Florastor. Florastor is really good. And then there's a prebiotic that you can get. I think it's made in the UK. You can get it on Amazon. It's called Bimuno, Bimuno. And Bimuno is really good because Bimuno in clinical studies has been shown to like reduce the risk of having traveler's diarrhea by like a third. So Bimuno before you go and while you're there, and then like a day or so after, and then Pepto-Bismol. So if you're going to pack anything in your case when you travel to any area, those would be two really important things to do. And really important is to get preparation H wipes in case you do get diarrhea, because a lot of people will get, rectal irritation, from just wiping with dry tissue paper. The Cottonelle ones are good as well, but the problem with the Cottonelle ones is sometimes that, they have some kind of detergent on them, which can be irritating to some people. Preparation H is just witch hazel and aloe,
Hmm.
and witch hazel acts as a good bacteriostatic agent. So
Hmm. And not only that, I mean, your rectal opening is one of the quickest ways to get to your bloodstream, correct? So you wouldn't want to have any kind of inorganic or chemicals wiping down there.
right.
Is that
Well, I mean, you're right, but you need to get on the anal sphincter for it to get to that. Yeah, outside of the anus, like
okay?
not really. You have to go in a little bit further,
Okay. Got it.
and yeah. So
I mean,
that's why.
go
Sorry.
ahead. Go ahead. Go ahead.
No, I'm saying that's why suppositories work. So
Okay.
suppository, like Tylenol suppositories and all these things work because you're right. They do get into the bloodstream earlier and more efficiently, but you have to go beyond the anal verge for that to happen. Whereas if you're just having diarrhea and you just wipe it, you're not going to get beyond that point.
Okay. Cool.
It's just external.
All right. Well, I prefer a bidet if there's ever one around,
Yeah.
and
You know,
like honestly, I'll just use my shower with my detachable shower head instead of having
yeah.
to go through all that.
No,
Um,
that's, they've done studies, and um, in countries where they have bidets at standard, Europe, their incidence of hemorrhoids and all that kind of stuff is a lot less, and
mm,
anal fissures and all that. It's less than it is in countries that like dry wipe. But yeah, bidets are are key. That's why I don't understand like all this like hoopla about like, oh my God, running out of toilet paper. I'm like, what's the big deal? Just pop in the shower.
Exactly. Right.
Right.
We have another question, and I think this is going to be the last one, and we're going to wrap it up with trivia. But what do you feel about vitamin drips?
Um, not a big fan. I think that they're okay if you're unwell and you're trying to kind of get over your sickness, like vitamin C, glutathione. That's probably okay. I see a lot of people that overdo it. I take care of a lot of celebrities, right? And a lot of them, I get it like every other day and I get my drips, but their veins are so scarred. And then like, it's the complications of it, right? Their veins get scarred. They have, some of them have infections, right? Some of them get phlebitis, even if it's non-infectious phlebitis, just from the trauma to the vein. Some people get blood clots. So all these things are unpredictable. So you have to look at the risk to benefit ratio. Is the benefit of you getting a vitamin C drip? And I know there's people on here that are probably gonna, negate me, but, and look, and I do integrative medicine as well. And yes, I do the vitamin drips in my office for people that really, really, really want them. But the ones that keep coming in, I need it like every day or every other day, you want to reduce the frequency of those because of the trauma to the veins.
Mm-hmm.
So I
Okay.
think they have a place, but you don't want to overuse them because of the potential risks involved.
Gotcha. Wow. Okay, that's really good to know. All right, we're gonna move on to the trivia, and I think you actually answered it correctly, Dr. Primus. I'm gonna read it again. McDonald's has recently stated that they would discontinue this at their restaurants in order to meet the new coronavirus hygiene standards. Was it A, the Big Mac, B, McGriddle's breakfast sandwich, C, self-service soda machines, or D, the Southwest grilled chicken sandwich? All right, Julia, do we have a winner? Hopefully Julia's there. We may have lost her.
Oh, sorry, I'm that boring, huh?
No, no, no. I think
I'm kidding. I'm kidding. I'm kidding. I'm kidding. I'm kidding.
yeah, no, no. Okay. Well, we lost her. I'm gonna I'm gonna have to ask her later. But okay, the answer I think it was everyone probably knows. For the 14,000 McDonald's restaurants in the country, in a long memo reported by the Wall Street Journal, McDonald's is reevaluating a mainstay of its locations, the customer-operated soda fountain, because of the challenges involved in ensuring its hygiene. The company confirmed this by pointing to Yahoo Finance to a press release. Okay, the beverage bars will remain closed or sectioned off and staffed in restaurants. All
Yeah,
right. So,
it
well,
makes it
congratulations.
makes it makes. No, I'm saying it makes total sense. I mean, I've been doing these pre-opening, so a lot of businesses, especially hotels, are planning to reopen. And I've been doing a lot of walkthroughs in how to prevent coronavirus. And one thing that, I've been doing, I mean, I do like 3-hour site visits for these people. And you go into the lunchroom, and the first thing I said is like, look, you got to get rid of the self-serve anything, not just the soda machine.
Yeah.
In fact, even the refrigerator, you should make sure people just bring their own bagged lunch and not serve any food and just let them bring it in on their own. Make sure the refrigerator is cleaned every day. So like the self-service thing is going to be out the window for a long time. They shouldn't have any, standard like cups, drinking cups and, silverware. They should all be disposable. Everything should be disposable now.
Yeah. Hmm. Not very environmentally friendly, but I think
Sense.
that's the way that things are going to have to go. I totally agree.
Well, they don't have to be plastic, right? They can be the bamboo ones and, like bamboo straws, and they can have, the bamboo, utensils. Doesn't always have to be, you can make environmentally friendly, utensils
Of
and
course,
cups. So,
compostable, that kind of thing. Yep.
yeah.
All right. Well, how can people learn more about you if they want to follow you, if they want to get a consultation? Tell us
So,
how we can follow you.
so my website is travelmd, like medicaldoctor.com.
Mm-hmm.
My office phone number, if anybody wants to reach me, is 212-737-1212. And
Okay.
then I'm on Instagram and under, I think, Dr. Primus, DrPrimas,
Okay.
and on Twitter at Primus, and Facebook Dr. Primus. So I'm all over the place. I'm like herpes.
Right on. Okay. That's going to be it. So thank you all for joining us tonight. Please do check
Thank
out our
you.
website, biohackthe.world, for all the latest news and updates, and watch some videos on Biohacker TV. There's also information on our next event, which is going to happen exactly 1 week from today with the venerable Dr. Frank Lippmann and co-host Dr. Rudy Gurman, who will be joining us to give us some much needed perspective on the future of leadership in the health and medicine space. And if this episode spoke to you, please share it with a friend or two and leave a positive review. Also, please remember to connect with us on social media and sign up for our weekly newsletter for some of the best news, opinions, and jokes on the planet. Until next week, stay hungry, stay safe, and good night.
All right. Thanks, David.
Thank you, Primus, Dr.
All
Primus.
right.
Love you, man. All right.
Love
Cheers.
you, man. See ya. Take care.